As far as calming supplements that people use day to day and that we recommend, one of our favorites is called L-theanine. This is a constituent of green tea. It's not the caffeinated part of that, but it's the calming part of that. And we find that 100 milligrams 3 times a day is enough to calm most people. It's just enough to take the edge off without being too sleep-inducing. Some herbs that you may have heard of, one is Melissa, which is the lemon balm, is very calming. Lavender is very calming. Holy basil is an ingredient of some of these calming supplements, as well as oats, Avena sativa. Look for that one. Those 4 can be very calming, and they're ones that we use in tinctures and botanical remedies all the time. Adaptogens is another class of botanicals that you should be looking at. What is an adaptogen? It is like it sounds. It kind of goes in the body and it goes to where it's needed. But when we're really stressed out, it does have an affinity for the adrenal. So these are things that you may have heard of called ashwagandha, rhodiola, eleuthero. These are really common adaptogens that are in a lot of the herbal remedies we have in our supplement store. The other thing you may have heard a lot of hype about out there is CBD. These are cannabidiols. We know them mostly as one of the constituents in marijuana. THC is the other one, and that's the psychoactive one that gets everybody high. These are products that do not have any THC, it's just CBD, but we have a cannabidiol nervous system throughout our entire body that pretty much is there, but goes unused. So CBD in the form of oils and other things can go to those receptors and turn them on and calm us down. CBD is now so widely available, you can find it at any drugstore, Walgreens or CVS, in small amounts. The one caution I would give on CBD is make sure you're getting the CBD that is right for you. We have people that come in that take it in the morning and it calms them down at a point where they're supposed to be woken up. And we have people who take too much at night and then they're sleeping through their alarm clock in the morning. So we recommend it mostly at night as a calming way to sleep, but there are strains out there that are sold widely that just kind of help take the edge off during the day. At Chambers Clinic, we recommend doing a neurotransmitter test. And what is that? Neurotransmitters signal throughout our body when we need something that's excitatory or when we need something that is inhibitory. So what does that mean? Excitatory you can figure out. It kind of lifts us up. The main excitatory neurotransmitter is called glutamate. And you can imagine if we had too much glutamate going on in the body that it really hypes us up. So we want to do things to help ramp it down. On the flip side of that, the inhibitory neurotransmitters lower things down. The main one is GABA. We don't want too much GABA because it's going to calm us too far down and put us to sleep, but we also don't want too little GABA because it has the opposite effect and it hypes us up. So how do we maintain a balance? One, you get a result of that neurotransmitter test. You can take a look at the individual neurotransmitters, glutamine, GABA, other ones that you've heard of like serotonin and dopamine, and we can try to figure out, like, are you deficient in one or in excess of another one, and balance that out. The number one drug that's given out there for anxiety and depression is called an SSRI, a serotonin selective reuptake inhibitor. They're just simply given out when somebody is depressed or perhaps when they're anxious. And nobody ever tests, well, do you have too little serotonin or too much? They just hope that they work. At Chambers Clinic, we use these neurotransmitter tests to really balance things out and get to the root cause of what's going on. So it's really important to understand what that is. And then when that happens, we can give an appropriate supplement or herb or do an appropriate type of treatment to really help to make that balance right. One other thing I would mention that is good. If you're somebody who's prone to panic attacks, again, get that neurotransmitter test, but there are a lot of homeopathic remedies out there as well. One that's widely available, CVS, Walgreens, and in our office, is called Rescue Remedy. So if you feel yourself getting hyped up, you can just take a pastille or two. They're like little candies and it can help to calm down. It's non-invasive and non-pharmaceutical, and it can really help get through hyperactivity or panic type episode. These things, again, you can find in CVS and Walgreens, and you can always call our supplement store. We're full of advice and can direct you to the right supplements to calm you down from acute stress.